Hello and welcome back to Drug Basics. This is part two of a three-part series for lesson two on drug basics. The topics for this lesson include what drugs are, how they work, routes of administration and elimination, and tolerance and withdrawal. This part two of the lecture will be covering routes of administration and elimination. Basically, what that means is how do drugs get into the body and how do they leave the body? So getting into the body, the routes of administration, there's four ways that drugs can get into the body. There's orally, there's through an injection with a needle, inhalation through the mouth or nose, and absorption through the skin. Oral administration of drugs is the most common way that drugs get into the body. This can be in pill form. It can be dissolved in a solution like a liquid that would be drunk. It's generally the safest way that drugs can get into the body, and partly that's because it takes the longest for the drug to start to have an effect when it's ingested orally. That's because the drug has to move through our digestive system. So there are many different ways that that has an impact on the efficacy. One is that food itself, just physical food in the stomach, slows the absorption of the drug through the small intestine. And also because it's in our digestive system, the drug gets filtered through the liver. So that biological process of digestion means that the more of the drug is broken down, that bioavailability of the drug, how much of it reaches the receptor sites, is generally lessened through oral administration of a drug. When it comes to injection, using a needle to administer drug, there's three different types. So a needle it really relates to the depth of the injection or the location of it. So if it's just going under the skin, that would be a subcutaneous needle. And that's called sometimes skin popping. It's sort of a slang word for subcutaneous injection of recreational drugs. Intramuscular administration is into a muscle. The flu shot, for example, has to go into a muscle in your upper arm, and that's what causes that muscle ache after you get the flu shot. And then intravenously or into a vein is another type of injection. And so this route of administration it's the fastest of all of them because it's a direct hit of the drug into the bloodstream. There is no do not pass go, do not collect $200. It goes straight into the superhighway of the body. There are some risks to intravenous drug use, either for medical purposes or recreationally. There's a risk of infection or illness because the needle is itself entering the bloodstream as well. One way around this in terms of preventing infection or illness among recreational drug users, I mean, in a medical setting, needles are sterile and they're sterilized in between use or they're one-time use injections, and there's no risk of very little risk of contamination. But in recreational drug use, coming across sterilized setting or sterilized needles is extremely unlikely. And so the risk of infection or illness is very much increased when it comes to recreational injection drug use. And so a public health solution to the problem of needle-related illness is needle exchange. So it's a system where intravenous drug users bring their dirty needles to a center that collects them and disposes of them safely, and then issues sterile needles to the user. And this is a component of a harm reduction approach to drug use. So really trying to minimize the damage that's being done to drug users by drug users while targeting those consequences without necessarily targeting the actual behavior itself, which is uh, becoming more popular and common in places like Canada and in certain cities in the United States. Baltimore is one of them. But it does have some resistance. There are people who really find this to be controversial. So actually, if you take the addictions treatment course that we offer, we talk about harm reduction in that class more. So the point here, though, for intravenous drug use is to know it's the fastest way for drugs to get into the body, but there are many risks that go along with it. Another method of administration of drugs is through inhalation. And so that can occur both with smoking through the mouth, inhalation of a substance through smoking, like cannabis or cigarettes. It also includes inhaling vapors, and that can actually occur both with the nose and the mouth. Oftentimes, when people are inhaling vapors, they're using a bit of the substance in some sort of bag that goes over both the mouth and the nose, so that both organs are involved in inhaling something like paint thinner or some other psychoactive inhalant. This is a very fast route of administration because there are many, 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 many capillaries inside the lungs. So the vapor or the smoke reaches the lungs, which are then coated in capillaries, and it goes basically right to the bloodstream. So it versus something like the digestive tract, which has a long way until you get to the small intestine where there are lots of capillaries. Smoking just goes right to the lung, and then boom, the bloodstream from there. Intranasally is another form of inhalation, but the absorption occurs at the route or at the point of contact with the mucous membranes of the nose. So the capillaries are within the nose itself. So this is another very fast route of administration. It's faster than smoking. And it can, just like smoking can cause damage to lung tissue, intranasal or snorting or sniffing a substance can hurt the lining of the nose. It can be an irritant. The mucous membranes in our bodies, in our nose and our mouth, these are really sensitive parts of the body, and coming into contact with an abrasive powder, something like cocaine, for example, can really start to irritate the nose, causing nosebleeds, or even in really severe cases, wearing away of the septum, the part of the nose that separates the nostrils, can start to get broken down, and people can end up with lots of different complications from that. Another route of administration of drugs is through the skin, so transdermal absorption. This is a relatively slow rate of administration. It has to get through the skin to get into the bloodstream, the capillaries that are subcutaneous. A benefit of this type of administration is it avoids gastrointestinal problems because the drug does not have to move systemically through the digestive system. Nicotine patches, nitroglycerin patches, fentanyl, which is a type of opiate, those are all examples of transdermal absorption. And so it's a patch that is stuck onto the skin, and the drug is released slowly. It's also a way to release a low dose of a drug across a long period of time. So there's hormonal birth control even that is administered through a patch, and that lasts for the entire month, versus having to take a pill daily. Oral, so this is even slower than something like a oral digestion. Sublingual absorption is another type of absorption. So rather than through the skin, this is occurring under the tongue. Sublingual literally means sub, beneath the tongue. Nitroglycerin and Suboxone are both taken this way. Nitroglycerin is a drug that's used for heart disease, and Suboxone is used as an opiate agonist. It's a way of helping treat opiate addiction. This is a good pathway of administration for drugs that are irritating the stomach. So again, it avoids that GI system problem, and it still is a relatively slow route of administration. So depending on the way that a drug is ingested, how it's taken into the body, and also the effectiveness of the drug at the receptor sites. All of these different factors are sort of taken into consideration when trying to determine how effective a drug is. So not all drugs are recreational, right? There are many, many drugs that are taken with a specific purpose. And so how do you balance how good a drug is at achieving that purpose versus how much of that drug is toxic? And that's done by calculating the therapeutic index. So, how therapeutic or helpful is a drug? And that compares the efficacy of a dose of a drug with the lethality of a dose of a drug. So, the median effective dose, or ED50, is the dose at which 50% of people who take it will experience a certain effect, usually the desired effect of the drug. And then you divide what you then consider is the lethal dose. So the dose at which 50% of lab animals who were given that dose of the drug died. And so you divide the lethal dose by the effective dose, and that gives you the therapeutic index. And so the higher the index, the safer the drug is. All medications are given a therapeutic index. For some medications, the therapeutic index is relatively small. So for lithium, a small amount of the amount of medicine that is needed to have an effect on individuals with bipolar disorder is so high that at that level, it becomes close to toxic. And so the therapeutic index of lithium is small because the effective dose is small compared to the lethal dose. Time release medicines can help increase the therapeutic ratio. So the time release means that a certain medication won't be administered all at the same time. It gets slowly administered throughout the body, and that keeps the lethality of a drug down. There are certain biological characteristics of individuals as well that have an impact on the efficacy of drugs. So, in general, women have a greater sensitivity to drugs than men because of a greater proportion of fat to water in the body than men do. And again, that's a broad generalization, but and so you could have actually two women who have a very different um, response to drugs based on their body fat percentage, just like you could have two different men who have a different response to drugs based on their body fat percentage. But in general, women tend to have a higher body fat ratio, so then they're having a greater sensitivity to drugs. The heavier the individual, the more they weigh, the greater the dose needed to achieve drug effects. So part of that's related to metabolism. Another part of that is related to just the different rates of absorption in body fat and the way the body breaks down a substance. And then age also has an impact. So generally, very young babies, infants, young kids, and elderly people are generally more susceptible to drugs and their dosages. So we talked about how drugs get into the body, and then drugs, once they are used by the body, also have to exit the body. And so the primary way that drugs leave the body is through urination. Enzymes in the liver and kidneys break down the drug as it moves through the bloodstream. The blood flows into the liver, flows into the kidneys, and these are the filtration systems of the body, start to break the drug down to eliminate it through urination. Because of this systemic process, and when I say systemic, I mean it's moving through body systems, drugs can really heavily damage the liver and the kidneys through long-term use. It puts a lot of miles on those organs and really causes them to work overtime compared to someone who's not taking drugs. And so, for example, someone who drinks a lot of alcohol can get cirrhosis of the liver because the liver is just constantly having to process and filter out the toxic the toxin, alcohol itself. Drugs can also be eliminated through exhalation, the breath. They can be eliminated through sweat, saliva in the mouth. They can be eliminated through excrement or feces, and then also through breast milk. So basically anything that can be excreted from the body, drugs can be found in those body fluids. Relevant to the elimination of drugs is its half-life. So the amount of time it takes for one half of the drug to be eliminated from the body. Generally, the longer it takes the drug to leave the body, the longer the drug affects the person. So the longer the half-life, the longer the person's going to experience effects of the drug. So because drugs are eliminated through all of these different body systems, this is the primary way that individuals are tested for drugs. And how drugs can be tested, it really is affected by a number of factors. But some sources of we'll talk about those. So one is the source of of drug testing. So are you testing hair, blood? Are you testing the urine? Are you taking a mouth swab? Are you doing a breathalyzer? These are all different types of drug testing. We'll talk about these in more detail. In urine, the other factor that can impact drug testing is what drug are you testing for? So if you're testing for alcohol, alcohol can only be detected in the urine for a few hours, versus cocaine and opiates can be detected for 3 or 5 days. Cannabis can be detected for 30 days at least, sometimes a couple of months, 60 days. Benzodiazepines or barbiturates can be up to 30 days. So not only does it matter what substance of the body you're testing, but also what you're looking for. And then going back to the different types of drug tests. So urine, we just discussed that it varies in terms of the detection that how long it takes to detect drugs. In the breath, alcohol can be detected in the breath for a few hours, but that's the only substance that can be detected that way. Hair can be detected for an infinite amount of time. Drugs that are located in the hair stay there. It's sort of a repository for drugs in the body system. Drugs in the blood only last for a few hours. Same with perspiration or sweat, and with cheek swabs. Actually, no, sorry. Cheek swabs last for a few days in saliva. So there are a couple of different ways that people try to tamper with drug tests, and some are more effective than others. So one is using another person's urine, so substituting a person who hasn't taken the drug instead of using a sample of a person who has taken the drug. The way that can be very effective because there is actually no drug in the urine. But there are very smart people who are doing the drug testing who've worked up ways around this. So one is observing the urine screen itself, so watching the person provide the urine sample themselves. And another is measuring the temperature of the cup, so making sure that the urine sample that's being provided is at a temperature that would be if it was a fresh sample. Another way that people try to tamper with drug tests is by adulterating them, so using a substance that masks the drug results. So this would be like adding something to the urine to cover up drug results. And again, it would be effective, except that people who are doing drug screening will require someone to wash their hands first, or again, observe the collection of the sample, or collect the sample at a random time. I mean, that's an option for all of these ways of tampering with drug tests, such as sort of surprise drug test that doesn't allow the individual time to mess with the results. And a third way is dilution. So just drinking a ton of water, or taking oh gosh, I can't remember the name of these But there are like drinks that you can buy that are supposed to like flush the system or remove the drug from the body. But really, what it does is it just dilutes the urine and makes it so that there's an indetectable amount of the drug because there's such a small amount of urine that's coming out versus water or this other substance. And again, sometimes urine tests can show if a sample was diluted, so it won't come back negative, it'll just come back inconclusive. And so then the tester can just ask for a retest. Or they'll use random collection. So again, just surprise, I need you to drop a drug sample. And that's a way to get around people trying to dilute their samples for drug tests. All right, part 3 is coming up next.